In this episode of Canopy Let's Talk, Doctors Ben Lawrence and Richard Sullivan explain what the terms precision medicine, genomics and immunotherapy mean, and how they might help improve outcomes for cancer patients.
The future of care for people going through cancer, a diagnosis of cancer, is evolving rapidly. And we often use different words, precision medicine, genomics. This is all about trying to be smarter. So it's trying to understand that particular cancer for that particular individual and how you can be more specific in the treatment for a better outcome. And also importantly, less toxicity. So, one of the challenges when people are going through cancer is just firstly, the diagnosis and that implication and the impact for them in their life and what it means. And then the second one is, the changes to their body, so if they need surgery and what does that look like, and then there's the treatment part and the toxicity. And so precision medicine is trying to reduce the toxicity and improve the outcome.
It's an amazing time to be working in oncology and looking after people with cancer, because in the time that I've been practicing, I've seen a shift from chemotherapy to everybody to, in some cancers, we don't use chemotherapy at all anymore. The big change at the moment is our ability to understand what's in the cancer and match that to a drug. But what we realise more and more is that there's a lot of variation within lung cancers or within bowel cancers. And we now know that that variation is caused predominantly because of different combinations of gene mutations or gene mistakes that drive that cancer. And so we've started to, rather than thinking of all lung cancers as the same, for example, or all bowel cancers as the same, and using the same treatment, we recognise that they're often very different. And so we use a different treatment for each different type of those cancers.
Now, there are multiple layers to that in my view. So at one level, it's about saying what sort of cancer do I have, and can you be more precise about that cancer so you can be more directive about the treatment. And then you can get more specific and say, well, actually, do I have a subtype of a cancer, which is more precise again? So actually, do I need what's called a targeted therapy? And so I believe years from now, we won't talk about cancer in the lines of breast cancer, lung cancer, bowel cancer. It'll be around the genomic makeup. And it'll be around being more precise around how you use that. Counter to that, because there always is a counter, immunotherapy is a new way of treating cancer. It's an exciting new evolution that's occurred in the last 5 to 7 years. And actually, that tells us that actually it's not the cancer that's important, it's the immune system. And these drugs are targeted at awakening the immune system to treat the cancer. And so they're not precise at all. They are directed towards the immune system to deal with that. And so use the same drug across multiple cancers with good outcomes.
Immune therapies are a new kind of drugs that instead of trying to smash up the cancer cells like chemotherapy does, or switch off a gene that's falsely activated in the cell that allows it to grow in a crazy way, immune therapies allow the body's own immune system to attack the cancer. Cancer cells are clever and they can often evade our immune system and becoming invisible to the immune system. And so what these drugs do is, if you imagine a cancer cell sitting in our body with a veil over the top of it, is that these drugs essentially sort of pull back the veil, and the immune system says, oh my gosh, I didn't even realise you were there, and then can have a go at it. The nice thing about that is often the medicines aren't very toxic for the majority of people, so that they are better tolerated and can be very effective. Only for the right kinds of cancer, and only for those with the right kind of gene changes or the right kind of damage to the code that's inside the cell, so they can respond to these drugs.